Atrial fibrillation, commonly referred to as AFib, is a heart condition that causes an irregular and often abnormally fast heart rate. This irregular rhythm occurs when the upper chambers of the heart, the atria, beat out of coordination with the lower chambers, or the ventricles. So, how does that happen? Well, your heart is a finely tuned machine with an electrical system that keeps it beating in a regular rhythm. In a healthy heart, electrical signals travel through the atria, which are the upper chambers, causing them to contract and push blood into the ventricles, which are the lower chambers. The ventricles then contract, pumping blood out to the rest of the body. However, in atrial fibrillation, these electrical signals become disorganized. Instead of a steady rhythmic beat, the atria quiver or fibrillate. This chaotic activity leads to an irregular and often rapid heart rate, which can significantly affect the heart's efficiency in pumping blood. This condition is quite common, especially among older adults. It's estimated that around 2.7 to 6.1 million people in the United States alone have AFib. The prevalence increases with age, affecting about 9% of people over the age of 65. Causes of atrial fibrillation. Well, there isn't always a clear-cut answer, but atrial fibrillation is often linked to other health conditions. High blood pressure is a major contributor. When your blood pressure is consistently high, it can lead to changes in the heart structure, such as thickening of the heart muscle, which can disrupt the normal electrical signals. Heart disease in general is closely linked to AFib. Conditions like coronary artery disease, heart valve problems, and heart failure can all increase your risk. Even if you've had heart surgery in the past, that can sometimes lead to AFib down the road. But it's not just heart-related conditions that can trigger AFib. Other medical issues like thyroid problems, especially an overactive thyroid, sleep apnea, diabetes, and chronic kidney disease have all been linked to an increased risk of AFib. Lifestyle factors play a role too. Obesity, excessive alcohol consumption, especially binge drinking, and smoking can all tip the scales towards AFib. Even being very tall has been associated with a slightly higher risk, though researchers aren't entirely sure why. Symptoms of atrial fibrillation. Well, the tricky thing is that some people don't feel it at all. They might only find out they have AFib when a doctor discovers it during a routine checkup. But for those who do experience symptoms, it can be quite unsettling. The most common symptom is a sensation of a racing or fluttering heartbeat, known as palpitations. It might feel like there's a fish flopping around in your chest. Some people say it feels like their heart is beating too hard or skipping beats. Along with the unusual heart sensations, you might feel short of breath, especially when you're trying to exercise or be active. You could also feel weak, dizzy, or lightheaded. Some people experience chest pain or pressure, which can be scary and should always be checked out by a doctor, just in case it's something more serious like a heart attack. Fatigue is another common symptom. AFib can make you feel unusually tired or weak, even if you've had plenty of sleep. You might find that you don't have the energy to do your usual activities. Some people with AFib also experience anxiety or a sense of impending doom. This isn't just a psychological reaction to the other symptoms. It's thought to be related to how AFib affects your body's stress response. In some cases, AFib can lead to more severe symptoms like fainting or confusion. These are less common, but can be quite serious when they do occur. Diagnosis of atrial fibrillation. The first step is usually a thorough medical history and physical exam. Your doctor will ask about your symptoms, your medical history, and any family history of heart problems. They'll also listen to your heart with a stethoscope, checking for the irregular rhythm that's characteristic of AFib. The gold standard for diagnosing AFib is an electrocardiogram, or ECG, sometimes called EKG. This test records the electrical activity of your heart and can show the telltale signs of AFib, namely the absence of P waves, which represent normal atrial contraction, and an irregular ventricular rate. However, AFib can be intermittent, which means it comes and goes, so a standard ECG might not catch it if you're not in AFib at the time of the test. In these cases, your doctor might recommend wearing a Holter monitor. This is a portable ECG that you wear for 24 to 48 hours, or sometimes longer, as you go about your normal activities. It can help catch episodes of AFib that might be missed in a brief office visit. For even longer monitoring, there are event recorders or implantable loop recorders. These can record your heart's activity for weeks or even months, increasing the chances of catching those sneaky AFib episodes. Your doctor might also order other tests to check for underlying conditions that could be causing or contributing to your AFib. These might include blood tests to check your thyroid function and electrolyte levels, or an echocardiogram to look at the structure and function of your heart. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for atrial fibrillation. The goals of AFib treatment are typically threefold: to control the heart rate, to restore a normal rhythm if possible, and to prevent complications like blood clots. Let's start with rate control. Even if we can't immediately get the heart back into a normal rhythm, we can often slow down the rapid heartbeat associated with AFib. This is typically done with medications like beta blockers or calcium channel blockers. These drugs help to slow the heart rate, making symptoms more manageable and reducing the strain on the heart. Rhythm control is the next step. The aim here is to get the heart back into its normal sinus rhythm. This can be done with medications called anti-arrhythmic drugs, which help to regulate the heart's electrical system. However, these drugs can have side effects and aren't always effective in the long term. Another option for rhythm control is a procedure called cardioversion. This can be done with medications or, more commonly, with a controlled electric shock to the heart. It sounds scary, but it's actually a very quick procedure that's done under short-term anesthesia. The electric shock essentially resets the heart's rhythm, kind of like rebooting a computer. For people who don't respond well to medications or cardioversion, there's a procedure called catheter ablation. This involves threading a catheter through a blood vessel to your heart and using heat, which is called radiofrequency, or extreme cold, which is called cryoablation, to create tiny scars in the heart tissue that's causing the problem. These scars block the abnormal electrical signals, hopefully restoring a normal heart rhythm. One of the most important aspects of AFib treatment is preventing blood clots. Because blood doesn't flow as efficiently through the heart during AFib, there's a risk of clots forming, particularly in a part of the heart called the left atrial appendage. If these clots break loose, they can travel to the brain and cause a stroke. To prevent this, most people with AFib are prescribed blood thinners, anticoagulants. The choice of blood thinner depends on various factors, including your overall health and risk of bleeding. For some people who can't take blood thinners, there's a procedure called left atrial appendage closure. This involves placing a small device in the left atrial appendage to seal it off, reducing the risk of clots forming there. In addition to these medical treatments, lifestyle changes can play a big role in managing AFib. This might include losing weight if you're overweight, quitting smoking, limiting alcohol intake, managing stress, and getting treatment for sleep apnea if you have it. Regular exercise is also important, although you should always check with your doctor about what level of activity is safe for you. Now, we want to hear from you. Do you or someone you know have atrial fibrillation? What symptoms did you have? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.